This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. The aging process is an inevitable part of human existence, and all individuals who live to grow old experience this process. The science dealing with the process of aging is termed gerontology, and this science tries to elucidate the factors and details of the process of aging. Gerontology is thus associated with the elderly and the physical and psychological changes which occur in their bodies due to old age. Main body. However, this process may not be uniform for all persons, and there may be variations in the aging process of individuals, depending on their lifestyle and diet. The aging process is also highly impacted by hereditary factors, and it is interesting to note that while some individuals may age faster, others may not show signs of aging at the same pace. Nevertheless, the basic signs of aging are apparent among a majority of elderly persons. Many elderly persons above the age of 65 years have the activity of daily living limitation disability, while a percentage of 3% is completely disabled. Many chronic diseases including hypertension, diabetes, arthritis and hearing problems, and heart problems are commonly prevalent in the elderly. As people age, they begin to give less attention to their health and well-being, which sometimes results in severe problems at the physical and psychological levels. Growing old and aging is a natural process of the human body and one which is inevitable. Thus, innumerable changes take place in the body which leads to the degradation of health. This science which deals with the aging process of getting old is termed gerontology. As people grow older, there is deterioration in their health, and sometimes the wrong diets and activities can lead to further degradation in their health, leading to several deficiency diseases. The most visible changes which occur among the elderly are the sagging of skin and loss of hair. Skin pigmentation could also result in a change in skin color. With the increase in age, they sometimes tend to exercise less, which also reduces their rate of metabolism and could also result in weight gain. The gain in weight initiates many problems, with the reduced level of immunity in the weak bodies of the elderly. The aging process brings about internal bodily changes that also occur in the bodies, and the bones of the elderly become fragile due to the loss and insufficiency of calcium in their bodies. This commences physical problems like degeneration of the bones and subsequent problems like fractures. Certain other changes also occur in the bodies of aging adults, including a loss in eyesight and hearing abilities. Cataracts and glaucoma are some of the common eye problems faced by aging elderly persons. Loss of vision is also more common among the older populations. Internal organs also undergo many changes in elder persons. Organs like the kidney and the bladder lose their propensity to function well, and this causes many health problems among them. The lack of an optimal diet and exercise also tends to cause an increase in the fat deposits in the blood vessels of the elderly, which puts them at an additional risk of coronary artery disease, more commonly known as heart disease. The ability of the respiratory system also reduces, which leads to breathing problems. The United States Select Committee on Aging has confirmed that in the past 2 decades, there has been a phenomenal rise in the older population in the United States of America, which is further estimated to grow by 7 times as compared to its current size by the year 2050. This substantial rise in the elderly population is believed to create a rise in the demand for caregiving services for this relatively frail and dependent populace. Conclusion. According to several researchers, the primary reasons for this change in trend are attributed to an increase in the overall percentage of women working outside their homes and their participation in the labor force, along with other factors such as: although there are many formal caregiving services present for the elderly population, family members continue to be the prime caregivers to nearly 80% of the older populace of the United States. Thus we can conclude that aging is an inevitable aspect of human lives and a phase during which the elderly people need additional care and support due to their deteriorating health, and gerontology is the branch that deals with all the issues related to the aging process and old age. If you want to find more works like this essay on the concept of the aging process, head over to ivpanda.com. It has a collection of samples with thousands of submissions covering virtually all academic subjects.